Good evening, everyone, dear doctors, dear friends, dear colleagues. I am extremely pleased to welcome you on behalf of myself and my esteemed colleagues to this special online meeting dedicated to the application of the hybrid collagen stimulators Juvelook and Lenisna. Welcome to Julia 2024. Joining me will be Professor Bob KHANNA, Dr. Paul CHARLSON, Dr. Suk Pesel, and my dear friend from Poland, Dr. MONIKA KRET. Each of us will have an approximately 20-minute presentation, followed by a brief question and answer exchange between the panelists. We encourage you to submit your questions via the Q&A button at the bottom of the page. We'll address all questions together after all the presentations have concluded. I also want to remind you that our webinar has been accredited to the CPD group. So all attendees will receive a link and QR code, which will allow them to download the certificate of attendance and receive 2 CPD credits. The first lecture will be led by Professor Bob KHANNA, who has been practicing cosmetic dentistry and facial aesthetics for over 25 years and is one of the world's most eminent and respected facial aesthetics practitioners. He is clinical director for Dr. Bob KHANNA Training Institute and president of IAFA, professor of facial aesthetics, University of Seville, professor and chair of Advanced Medical Aesthetic University of Vienna, Doctor's Choice for Facial Aesthetics Tatler Magazine 2023, accredited training provider for Royal Society for Public Health. You will have the opportunity to attend training sessions on Juvelook and Lenisna at his institute, and we warmly invite you to join. The title of Bob's presentation is Natural Concept of Beauty, a change in the trend in aesthetic medicine in the UK and around the world. Professor Bob, your floor is yours.
Thank you very, very much, Dr. Bartek, and to my distinguished and esteemed colleagues, thank you very much. Welcome from the United Kingdom. It's just a little over 8 p.m. and I believe it's an hour ahead for you guys. And we're just as enthusiastic as ever to talk about this wonderful topic. I'm going to be talking about, as Bartek said, about how to create natural aesthetics, beautiful aesthetics via your treatment choices and anti-aging treatments, but making sure that at all times we adhere to proper natural concepts when it comes to beauty. Because of course, as you'll see in my lecture, unfortunately, I think we've lost our way, and we need to understand this and make sure that we go back on track so that our patients are treated to the very, very best treatments and options and, of course, outcomes for the foreseeable future. So without much further ado, I'll share my screen and we'll get started. Let me just share. There you go. Share. And here we have it. Right. I trust that you can all see the screen. Just give me a thumbs up. Yes. Yes. Amazing. Right. Now, for me, I've actually been training and teaching for nearly 30 years, actually. So not even 25 years. But I'm always of the belief that you're only as good as your last case, and you continue to learn. And I learn from colleagues, I learn from every conference that I'm teaching at. And more importantly, it's to be able to embrace trends that are, of course, going to happen from country to country throughout the whole world. And what we find is that, you know, if we look back at the last 75 years, things definitely have changed. We seem to have lost our attention to uniqueness. I think uniqueness in itself is beauty. And if we look back at the roaring 50s, you know, beautiful women, but they were unique. when we go into the sort of 30 years later, 3 decades later, we can start seeing the change, the turn of this kind of cloning, as I call it. And unfortunately, if we look at sort of where we are today, it disheartens me to see that, particularly with regard to females, that often they do end up looking very, very similar. I'm sure you'll agree with me. Now, I personally don't find this very attractive. I never have. I think it's good to keep nuances alive and kicking. And when it comes to patients, I think we should always have an individualized and tailored approach to treatments so that we can preserve the very uniqueness that I just referred to. Because that in itself is, of course, natural aesthetics. And then we see this kind of thing all the time. People seem to be in a rush to get their treatments done and overzealous treatment. And we see this not only amongst patients, but I see this amongst my colleagues in conferences, and it really is disheartening. And you have to understand, or try to understand, what on earth is going on. Do we just blame it on body dysmorphic syndrome? If that's the case, then surely there's a responsibility when it comes to the practitioners involved. This has to be. We obsess over symmetry when some of the icons that we look up to as being the sort of pinnacle of aesthetics are not aesthetically symmetrical themselves. In fact, if we put the two rights or the two lefts together, we find that the asymmetric situation was far more aesthetic. So a little bit of asymmetry goes a long way. So why are we trying to create symmetrical individuals, mathematically, geometrically perfect individuals, when actually we're already feeling and saying that a slight bit of asymmetry is more natural? And this you can see him with many, many celebrities. And in fact, without many exceptions, the asymmetric version will always be the most aesthetic. Lip augmentation is something that most practitioners around the world carry out. We must always understand that the aim of treatment is not only to meet patient expectations, and that varies, but we need to make sure that the outcome fits the face. So this picture in itself is wrong, because all you're seeing is a part of the story. We have no idea how these lips actually fit in terms of proportions to the rest of the features. But what we do have is a set of very beautifully constructed lips in a subtle and mild fashion. Sometimes we have challenging lip augmentation cases, such as these, and we know that these are probably one of the most challenging cases, like M-shaped lips. But if we're careful, we understand good technique, as well as use of good materials, we can overcome even some of these very challenging hurdles. But of course, lip augmentation in isolation is of course very restricted and very limited, because most people will need at some point a lot more. So as we age, often the midface, as we know, is under attack for many, many reasons. Not just from the aging point of view, but of course there are intrinsic and extrinsic factors that exacerbate the wasting of this area. So just by taking care of this area in a natural format, as well as the lips, we can actually address this balance and bring about a better, more aesthetic outcome in a lady who's in her late 50s. And you can see attention to detail in the upper face, the mid face, the orbital display, the lip balance between the upper and lower lip has all been taken into account. We must look at 3 dimensions, of course, as you know, to enhance the overall picture. And the same is true here. Just by treating the midface and the perioral region, we can bring about quite a significant change. Of course, I could do an awful lot more for this patient if that was relevant and if that was of priority to the patient, and we must always respect that. Not every single person wants to have every aspect of treatment for themselves. When we look at the full face, I mean, this is a 72-year-old woman. There's, I could dedicate a 2-hour lecture to just this patient. Now, it's clear there's a lot of damage that has occurred here, not just from a photo aging point of view. This patient is, as you probably guessed, an ex-smoker. She's got an awful lot of volume loss, bone resorption in a maxilla and mandible, which has heralded the sagging of the tissue in the mid and the lower face, and of course, the perioral confines. So by volumizing correctly in the mid face and the perioral and lower facial regions, it has a profound effect. And of course, the use of collagen stimulators, will also exacerbate this process and put you into a much better situation that actually will catapult this patient into a much better situation to combat the aging process. One of the things that I have been very involved with over my time is actually profile correction or profiloplasty. In 2009, I wrote a paper on this and presented this at AMWC Monaco, because I was getting sick and tired of people being treated in isolation for their chin, lips, nose, and mid-face and what have you, without no idea of symbiosis, i.e. that the harmonious connection between all of these features. So this is a typical sort of case that will walk into my practice after having had treatment. So in these situations, it's important then we bring back, just by dissolving some of the treatment that this patient's had and not actually even adding any further treatment, we've managed to achieve a much more feminized and acceptable aesthetic outcome. Because what we're trying to do is adhere to good natural concepts and natural aesthetic outcomes. This is what led me to actually develop my strategic system for profile correction treatments, which I published in the Journal of Aesthetics. Without going into too much detail, the idea is to make sure that at all points we treat the patient in 3 dimensions so that we have a good control over the upper face, the forehead, the frontonasal sulcus, down through the dorsum, through the supratip, and of course the nasolabial domain, the labial tissues, and then of course the labial mental region, and then of course the symphysis, which is comprised of the Pogonian, menton, and nathion. And then beyond that, the cervicomental region. All of these structures need to be harmonized together. And one area being treated in isolation will not be able to achieve that. If we look at this profile of this lady who's 57 years of age, dermatologist from Bermuda who came to see me, generally speaking, she's doing quite well. But if we look at her chief complaint was her lower facial region, as is typical for most females and males in their 50s. She has a slightly retrognathic mandible, which means that the submental tissues the aging process will be quite exacerbated in her case because of lack of support. So you can see the obvious, I'm not sure if my cursor will enable to show that, but the submental dip that you see beyond the menton into the cervicomental region, and then of course into the neck. But when we treat this lady correctly to balance these features, we can have a profound effect on the overall silhouette of her profile. And this will of course have a dramatic anti-aging effect. Again, adhering to good principles so that we don't violate natural aesthetic norms, but what we do is we essentially give this patient an aesthetic upgrade. And you can see here, this lady being treated. Not sure if you can hear the video. Can you hear the video okay?
Oh my God. It was exactly like that when I was 20. Wow. Especially my jawline and my cheekbones. I'll show you pictures when I was 20 and this is what I looked. Oh my God, I love it.
So this is, of course, what we're trying to achieve. We're trying to achieve happy patients that will effectively return for treatments again and again and again because they believe in your approach. And I think it's a winning approach. And this is exactly what I teach all my delegates all over the world, that actually you'll have staying power in this industry, this evolving industry, if you adhere to good principles and ensure that your patients do not look unnatural. It's very simple, very, very simple indeed. And this is something I see within the millennials and the Gen Zs, as well as, of course, the baby boomers and the Gen Xs. So we see this again and again and again. This is a little young lady I treated in Jordan, and unfortunately she has dark circles under her eyes. You can see here. Just show you this. The mid-face needs treating. Of course, in Jordan, they love to have bigger lips. And this is something that we need to somehow try to embrace. What I've done is actually enhanced the periphery to her lips to actually make her lips sit better. So her chin has been advanced, her jawline has been enhanced, her mid-face has been augmented. So we end up with a more natural aesthetic outcome. A full face approach again. You can see here the benefit of an overall full face transformation. What about men? We often don't talk enough about male transformations, but I'm finding, I'm sure you'll share this experience, that, I think now in my practice, I'm probably about 65–70% female. And that has definitely, so therefore 35 to sort of 30 to 35% male. And that's certainly changed. 10 years ago, it was probably near 5, maximum 10% of my patient base. And I think this is growing. This is a huge growth area. And what do males really want? They want to enhance, generally speaking, their maleness often. So if you think about what we're doing, males are often playing tricks with their facial fur. I see there Dr. Bartek has got beautifully coiffured beard. And, this is quite common. It's actually now more common to see a male with facial hair than it's not. And that's, again, a changing tide. It's a changing trend. Possibly we'll end up going back the other way. But for now, this is certainly something we see. And why are we seeing this? Because, of course, men have realized that the use of facial fur is actually very useful. It can compensate for what you don't have, but it can also frame what you do have. And that's quite useful, very, very useful indeed. It's like the lipstick for a man. This is like the lipstick framing man. So when I get young men coming to me with redundant jawlines and retrognathic mandibles, there's a lot that we can do here. Now, this person is not going to suddenly grow a jawline. That's not going to happen. If anything, it's going to get worse with age. And that will herald all of those things that I talked about: submental sagging, jowling, and then, of course, the collapse of the face and neck ratios. So we need to understand what we can do for these sort of cases. So we can augment very nicely, masculinize this young chap and give him a lot more confidence. And often that's exactly what these patients want. You see here where I've developed the chin and the jawline together. And this has actually enhanced the profile, as well as his nose and lips in this case. His lips haven't actually been treated. It just looks like they've been treated because I've transported that lower section forward. What about menopausal, perimenopausal ladies? And this is, I would say, probably about 50% of my practice now. And it's important to understand the changes that occur due to lack of estrogen primarily, because of course, lack of estrogen, not kickstarting those fibroblasts. Neocollagenesis is of course deteriorating for both collagen 1 and 3, elastin, and of course the extracellular matrix. So this is quite a typical sort of feature that I see within my female patients. So the mid face, the lower face, the whole of the face needs to be treated. And this is the point of the exercise. We can't isolate our collagen stimulation to just one area in patients of an age. This is a patient I treated actually at the face conference last year, live. So I'll just walk you through this. Profile needed to be corrected, but of course, we needed a full face approach. Peri-orbital, peri-oral, and of course, the lower facial region needed to be treated entirely. And this was all done together using a range of filler augmentation and collagen stimulation. What I'll show you in a second is a year follow-up. I only saw this, I've just snuck this particular case in because I saw the patient last week for the follow-up. And the important thing is, what we have is a wonderful change because we've actually got continued stimulation of her tissues, particularly her dermis, as well as her fat in this case, which is held for over a year. She's looking younger, more vibrant, and of course that means that she's going to be a lot happier. And this is the important thing. And again, you'll see this again and again, another postmenopausal lady. So it's important, I think, that we understand this. What about the older ladies and older men? So within the, when we achieve the 6th decade, of course, all of those features that we talked about, the mid-face collapse, the perioral collapse, and then, of course, the lower facial region and domain are all undergoing the aging process quite considerably. Most of these patients don't want to look unnatural, so we do need to take a radical approach, but a careful and considered approach. So augmentation as well as collagen stimulation combined. So this photograph was taken 3 months later. You can see the change in the quality of her skin, the volume in her mid-face, perioral region, and her jawline combined with a full face approach. I like to follow these patients up over several years. And so I'm going to finish with some patients just to show you some 7-year recalls of what I call the reverse aging process. And you can see here a typical lady who's had a lifetime of worshiping the sun, smoking, and sex, drugs, and rock and roll, as we say. So it shows on her face, as is typical. But this is the patient after years of treatment, maintenance treatment for volume loss, as well as stimulation of her collagen. And she's actually looking younger now than she did when she was 53. I've chosen an even more challenging case. This lady used to smoke 45 cigarettes a day, bathe herself in olive oil, and fry herself in the sun. Quite a typical story that we find for people of this generation. But you can see here, I've managed to reverse the aging process over continued treatment and maintenance. So I think the future is very, very bright. I think if we adhere to good principles, as I said before, and we use good materials, good concepts, good techniques, I think we can actually change the mindset of our patients as well as our colleagues so that we can achieve beautiful results. I'm going to finish with quite an endearing case. You've probably guessed this. This is my mother. Now, at the age of 22. Now, a lot of people don't realize, but she was my very, very first patient ever. So, I started with toxin back in 1996. She was my first victim, along with my father. And since then, I have maintained my own mother through a series of treatments, including volume replacement and augmentation with fillers, threads, collagen stimulation, but absolutely no surgical approach whatsoever. And I want to show you her picture now. She's just turned 80, and we just celebrated her birthday last month. And this is my mother. I'm very proud of this because A, she's my mother. And secondly, I think she looks incredible. She's a good walking advert, not only for 80-year-olds, but also the benefits of natural aesthetics. So I want to say a big thank you to you all for listening to me. I'm going to be happy to take any questions. But like I said before, the most important thing is to think of the long term for your patients, not the short term, and try and move away from this fakery, this awful non-aesthetic outcomes that we're seeing all over the world, because I really don't think there's any place for it. Thank you very much, ladies and gentlemen.
Thank you, Professor Bob KHANNA. It was a marvelous presentation, as usually, as always. It was a great pleasure to hear you at this marvelous presentation. So I would like to address 2 questions.
Sure.
Because we observed that in Poland, this trend in natural approach to the aesthetic medicine is quite popular for at least a few years. Do you observe the same change, or why this change? I think it's quite late in UK, because I think it's a little bit right now happening, comparing to Poland 3 or 4 or 5 years ago.
I think clearly you're a lot smarter than us. Look, there's a number of reasons for this. I think, you know, we have reality shows. We have pretty much every youngster is on social media regularly. And of course, we know there's a lot of fakery that surrounds that, a lot of filtering and airbrushing and what have you, which is not really serving our youngsters very well, because of course they have a distorted understanding of reality. And so they're often trying to achieve outcomes that just aren't real. So unfortunately, they've lost their way, but that's, again, a further indictment and a further wake-up call for us as considered and reputable practitioners to actually address those things and actually make sure that we remain ethical in our approach, so that we can educate our patients, so that we can follow you guys in Poland and actually look at the more natural route, which is, of course, the correct route. Because, you know, if you've got a good handle on the aging process, and rather than put a plaster on the problem, you're actually trying to identify the root cause of the aging process, stimulating collagen for one, by many means. That's a very clever thing to do. And if I was, you know, turning back the clock to when I was in my sort of early 20s, and somebody had told me, look, listen, you know, you need to look at this, this, and this will really, you know, serve you well in the future. I would have, you know, probably at the time not been that willing to listen, because of course people want a quick fix. Now, I personally haven't had any treatment whatsoever apart from a bit of toxin and good skincare. All right, I've resisted the attempt to have any sort of unnecessary fillers in my face, because I've never liked that look, you know, for you know, overfilled look. But certainly, I'm a great believer of collagen stimulation. I think that definitely is the message we need to propel to all of our patients. And of course, we can start this very, very young. So I think it's a great movement, and I think I applaud all of your efforts in this field. I think it's a fantastic opportunity to really now catapult this across the world.
Right. So how can you address the expectations of UK patients from our clinics, aesthetic medicine clinics, how they look right now, what they expect from us practitioners in everyday life, in everyday practice?
Look, I think it's important to be quite firm about these things. I mean, I'm very, very clear as to what I'm happy to provide for my patients and what I think is best. You know, at the end of the day, they come to us as the expert, right? So it's only right that we offer the best advice. Now, of course, that advice will, of course, vary from person to person, you know, and I think you should work within your comfort zones, and I think you should make sure that you always have the patient's interest at heart. The reason I showed my mother is really just to further reinforce the fact that I truly believe you shouldn't be doing anything to a patient that you wouldn't do to a loved one. Treat your patients like family. It's very simple. That's exactly what. So I treat them like family. So for me, it's very easy. It's not even a complex issue for me because I'm speaking from the heart. You know, so it just flows naturally. I literally do what I think is right for the patient, and I won't allow my patients to lose their way. But unfortunately, we're seeing this happen the other way in many clinics, and it's a sad reality, but it's down to us to address that, right?
Yeah, that's it. That's our job.
That's our job.
KHANNA, thank you for a great lecture. Thank you for your work. Now I would like to present you Dr. Paul CHARLSON, who will be the next lecturer. He is an aesthetic physician and key opinion leader in aesthetic medicine with over 20 years of experience in the specialty. Dr. Paul is former president of the British College of Aesthetic Medicine, fellow of the Royal College of General Practitioners, British College of Aesthetic Medicine, and the Royal Society of Medicine. He's also a masterclass trainer for Juvelook Lenisna, conducting training sessions in various locations, including London, which we warmly invite you to attend. This title of his presentation is Juvelook and Lenisna Third Generation Collagen Stimulators, Why Technology Matters. Dr. Paul,
hello there. Hello, thanks very much. I'm sorry I don't have that background, but I'm up in Yorkshire and we haven't actually got it up here yet. But I hope you can see me from my clinic. And I've been practicing aesthetic medicine now for 24 years and used collagen stimulators for a large percentage of that time. And they've always been going in the background. I agree with Bob that in UK we've been very late to really embrace these as a tool, as a mainstream tool in some ways, which is disappointing. And hopefully people will want this more gradual, natural look, which I think is the way to go, really. And there's sort of lots and lots of my patients are now saying the overfilled look. I don't want fillers because I don't want to look overfilled. So I think this is definitely the way forward. So I'm going to talk about why collagen stimulators are good and why particularly these third generation Lenisna and Juvelook are absolutely fantastic and will revolutionize your practice. So we'll start the actual lecture, which does contain quite a lot of facts. So I hope to make it as interesting as possible. Can you see the lecture now? Okay. Right. Does everyone see that on screen? Thank you. So I'm really going to talk about Juvelook and Lenisna, which are third generation collagen stimulators, and why they are why they're important and why technology really matters. So I'll just move on. Okay. Let's get it away. So Juvelook and Lenisna are poly-D-lactic acid, PDLA. They're enantiomers of polylactic acid, and those are the two commonly used collagen stimulators in aesthetic medicine. And the advantage of PDLA is that it maximizes the surface area of the molecules and increases the collagen stimulation. So as you see in this picture, there are the three generations of collagen stimulators, and you'll probably be familiar with some of the earlier ones, which have been used for some time. And these are really quite solid crystalline structures, which have quite a large variations in their molecular size. And the second generation are more spherical and hollow, but both the first and second generations require methyl cellulose as a vehicle, which isn't as good and compatible as the third generation ones, which are Juvelook and Lenisna. Now, this is a lovely round, foamy molecule, sort of mesh structure, which is 80% air, and stops it collapsing in, and you can use hyaluronic acid as the carrier, which is much better. It's more bio sensitive and able to, it gives a nicer result from an early age. Okay, I'm sorry, wrong way. So here you see the PDLA microparticles. You've got the outer structure, which is this round foamy thing, which causes minimal damage to surrounding tissues. The outer structure is a porous mesh-like substance, which is 80% air. And the advantage of this mesh-like structure is it increases the durability and acts like a big scaffold around for the giant cells to congregate around, and that can increase collagen production. And also these particular structures don't fall apart so quickly as the earlier types, and are more robust in their structure. So you get a nice, the message to get away is you get a nice uniform collagen production. So PDLA is a third generation collagen stimulator. And the advantage of this is it is particularly good at stimulating new collagen fibers, new elastin fibers, stimulates angiogenesis, which is really the new blood vessels coming into the skin, which are actually vital because we lose these as we age. And also it increases the elimination of reactive oxygen species. And this is really fundamental because as we age, this is one of the things that causes tissue destruction and reduction in collagen fibers, and also leaves small collagen fiber fragments in the skin. So we get a reduction in production of collagen, we get increased collagen destruction, we get collagen fibers, fragments, and we get reduction in blood vessels in the skin. So it's really vital to reduce reactive oxygen species. The other things that this particular molecule does is it increases macrophage modularization, again leading to new collagen and elastin production. And there's something else, which is ACS, which is stimulated. ACS are actually adipose-derived stem cells, which increase the fibroblast activity and collagen synthesis. So these are all vital things in kind of reversing aging, what Bob was talking about as a sort of reversing of aging that we see, much more than dermal fillers and even much more than the earlier types of collagen stimulation. So they're really very good products for anti-aging. They provide a nice gradual result. In my practice, I find they produce a lovely glow, really, and I'd call it the Lenisna or Juvelook glow. The skin glows, it reduces wrinkles, and gradually with Lenisna, you get revolumization of areas that you have lost. So it's a great treatment. You can cover great areas with it, and there's a science behind that. So looking at the advantages, PDLA lasts longer than other collagen stimulators, such as calcium hydroxyapatite, about 18 months to degrade. And the volume of the product can be used, varies according to the type of product. So for instance, Juvelook, we're using 8 mils, and with Lenisna, we can use up to 20 mils. So you can cover a lot of ground with these products, which is absolutely fantastic, because in truth, when people come for dermal fillers, the amount of product you've got for the cost is quite small in terms of volume. So you can get a lot more volume with this. So they're particularly good with people with more aged skin that is saggy, where you've got to do a whole face volumization and don't really have that much product to work with. The other great thing about PDLA is that the effect duration, which is much longer than calcium hydroxyapatite, for instance, and can be sort of 3 to 4 years. And you can also use it, Juvelook, around the eyes. So Juvelook's a fantastic product for this sort of peri-orbital area, even the upper eye, and into the sort of tear trough region. So it's a brilliant product for that. And for the body, you can use Lenisna, which is super for areas such as the abdomen. And I used it in bingo wings as well, and that's quite good there. So there's some great advantages with these products. So let's talk about Lenisna first of all. This comes as a single vial. Its particle size is 40 to 80 micromillimeters. Its injection depth is subcutaneous or subperiosteal, and it lasts about 12 to 18 months. Making it up, you can make it up in 16 mils to 20 mils using either normal saline or water for injection. But if you're going to use water for injection, you need to use, or both, you need to use some lidocaine. It can be injected with a 25 gauge cannula of varying lengths. But in fact, you can, I find that I actually use a 22 gauge cannula quite a lot of the time because I feel it's safer for use. But I agree that people have their own feelings about that. But it's great because you can cover big areas with these cannulas, particularly the longer ones, which makes it very easy, not too many injection sites. So it's pretty useful. So Lenisna, as I said, is used for facial volume reconstruction. It creates skin tightening, which creates a lift. So it can be used in areas, particularly the back of the face and into the temple and scalp, to kind of give lift behind the ligaments. It can be used as a skin rejuvenator, and it can use for volume reconstruction of various body areas, and we can use it in the buttocks, the belly, the thighs, the arms, and it can be used to reduce cellulite. So it's an incredibly versatile product and can be used in many, many areas. So how do we make it up? Well, what we do is we add the diluent, which is water for injection or normal saline. We mix it using a vortex, and you need the vortex mixer. The days of just shaking it, as I used to with the type 1s, are gone. You need to mix this for 30 minutes. And after you mixed it, it's ready to rock and roll, ready to go. So what we tend to do, and you need to stick to the same protocol when you're doing this. So what you need to do is make it up in 5 mils of diluent plus 1 mil of lidocaine, and then you mix it in the vortex mixer. Then you use a 20 mil syringe, you get the 6 mils of pre-mixed Lenisna with lidocaine, and you add sterile water for injection so that you can make it up to 16 mils. What you do is you get two 20 mil syringes and you, with a connector, and you just mix the two together. So you get a mixed product of either 16 or 20 mils, depending on what site you're going to use it for. Then you transfer this to 3 mil syringes, and I use the Juvelook ones, and you're ready to go. Oh, going the wrong way. Sorry, just lost the. Oh yes, the body. Oh, sorry, I've got that muddled. Yes, the body protocol is the same except for with a 20 mil. So Juvelook's the other product. This is the smaller product, and it's between 20 and 40 micromils. And you use this really as a skin booster, really, I would say. So you can use this in any site around the face and the hands, and it's great around the peri-orbital area, but it's also pretty good for using in the face. And I had a patient today, I used it in the neck, and you use it deep intradermally, so a few millimeters in, 2 to 3 millimeters, and you need to repeat it after 6 to 8 weeks, but it creates a lovely glowing skin and reduction in wrinkles because of the collagen production. Generally, we use it with a cannula. Certainly in the lower eyelid and tear trough area, you'd use a smaller cannula. But otherwise, you might use a 25 gauge cannula, or you can use it as a sort of mesotherapy, either with a needle or a mesotherapy gun, or with radio frequency attached to that. So there's quite versatile use of this product. So just to recap, the indications for tear trough treatment are the lower eyelid skin, the dark circles, global skin rejuvenation, and acne scar reduction. And I use it quite a lot in acne scars, and I find it excellent for injecting into the scar a small amount. So you raise it just slightly above the surface and massage it down, and it's fantastic for that, and probably one of the best products for acne scar treatment. It's also quite helpful in things like large pores and also stretch mark reduction. So the protocol for mixing Juvelook is 7 mL of sterile water injection, or 8 mL of bacteriostatic or normal saline. And with the sterile water, you need to use lidocaine. So you mix it all up in 8 mL, put it in the vortex mixer for 30 mL, and you're ready to rock and roll again. So looking at some treatments here, these are before and afters of Juvelook and Lenisna. These are Juvelook ones. You can see quite a reduction in wrinkling and dark circles as you get a thickening of the skin, and you can see that reduces the sort of visibility between the two. And again, there some excellent results. And my own practice of this is that it is an excellent product, and I personally think these collagen stimulators are underused and will be used more and more in the future. So I think if you're a practitioner thinking about using a product like this, you want to get onto it early and be one of the earlier adopters of these products, because I think that they're going to be asked for more and more by patients, because the results are good, they're safe, and long-lasting and cost-effective. Here's a picture of Juvelook treatment around the periorbital area. And another one here, very good. Wonder if you might recognize him. And here's one of the neck and backs of the hands, and both those areas are excellent. The neck, probably if you've got very thin neck skin, you want to start with the Juvelook and then maybe use Lenisna with the second treatment, but you could use 2 Juvelooks. But people with thin skin often do better with the Juvelook first. And again, you've got some with loose skin in the abdomen here, and it's very good for this kind of area. And the face, you get some volumization. And often when you look at pictures of before and afters, it's very difficult to get kind of things that do justice to the results. But when you look close up, often you see a reduction in fine wrinkling, which I think is key, because as you get older, it's your skin quality that really gives it away. So improving that, as well as some volumization, is key. And again, there's some pictures of some bingo wing treatments here and some buttocks, both of which do well. I think you need to do several treatments for the loose skin to get the maximal results, but it really is excellent for these areas. And these are things that are quite difficult to treat. So the take-home messages are PDLA is an excellent collagen stimulator, the most potent collagen stimulator. It's a 3rd generation product. So as I said, it's got advantages over the earlier products, which make it safer and more effective with more collagen. There's plenty of data behind it. So although it's quite new to some countries, particularly the UK, it will grow. And as more people use it and get results, they're going to be very pleased with it, and patients will start asking for it. And it's a very, very safe procedure, because one of the anxieties amongst practitioners particularly is the formation of nodules, which can occur and used to occur quite relatively commonly with some of the earlier collagen stimulators. But really, with this product, it's a much safer thing, with the risks of nodules being really very, very small, and you don't need to massage like the type 1 ones. So the mechanisms of these are the take-home messages. So I want to focus on these. PDLA stimulates new collagen fiber production. It stimulates elastin. It stimulates angiogenesis and new neovascularization, so more blood vessels. It increases the elimination of reactive oxygen species, which are potent in the aging effect. It modulates macrophages. It stimulates adipose-derived stem cells, which are important in increasing fibroblast collagen stimulation, and it decreases the degradation of mature collagen, so the collagen hangs around longer. So all in all, it's a great package because it's easy to use, it's safe, it works well, and it's cost effective. So I would say to people thinking about using it, give it a try. It will take a couple of treatments, and it will take time, as in all collagen stimulators. It's not an instant result like a dermal filler, but you get a much more long-lasting, natural result. And I think that's the key to it, in my view, is you get a great, long-lasting, natural result with glowing Lenisna or Juvelook glow, which patients will be very, very pleased with. So I hope you'll give it a try. Thank you very much. Have you got any questions?
Thank you, Dr. Paul, for marvelous presentation. We now know all the secrets of Lenisna and Juvelook and the ways of action, which is incredible. That I think it's lost the label of just collagen stimulator. It's a new kind of product, just a new category. It's not just a collagen stimulator. So yeah, it's a very interesting product.
Some lovely results there, Paul.
Yeah, I think the problem I think with collagen stimulators is always with patients is that people want instant results, and as you said, Bob, really the anxieties that people are getting more and more overfilled. So hopefully, with these products, if you can, it's about selling them really, and selling them to patients as a long-lasting rejuvenation, and the results take time, but once you get the results, they last for a long time. And I find patients often ring me and say, "Oh, I could do with some more." And I said, "Oh, I didn't think you thought it worked very well." And they said, "Oh, no, it's absolutely fantastic now. It's a phenomenal result." So I think it's a bit of a slow burn, but it is a fantastic product really, and hopefully patients will get that and see really.
So a question, Paul, that a lot of patients ask us, of course, is can you combine this with traditional filler techniques? I mean, not techniques, but could you potentially treat a patient for volume loss and then sort of overlay these procedures, these products on the same session? Or would you prefer to do this on a separate session?
Well, you can, but I prefer to do it separately. But and you can also actually mix hyaluronic acid filler with the Lenisna, for instance. So you could actually use the two together, so you get a bit of a wow factor at the very beginning. Yep. So you can do it. I quite like to do it as a stepwise approach, but there's no desperate need to do that really.
No, I think you're right. I mean, the power of stimulating collagen and not only collagen, as you alluded to earlier on, it was the great point which is often lost is angiogenesis, because the mere fact that you improve oxygenation to the tissues will actually have a profound anti-aging effect. And also, delivering those powerful antioxidants, or rather the antioxidant effect, reducing oxidative stress on those cells, will have a huge benefit It'll actually improve. It's been shown to actually improve on a number of levels, reduce inflammatory cytokines, upregulate anti-inflammatory cytokines, and improve mitochondrial efficiency of those very cells that are trying to produce the collagen. If you improve the energy values and the mitochondrial efficiency, which is exactly what happens when you impregnate oxygen into the situation, you actually allow the cell to produce the energy to do the job that it wants to do. So it makes total sense. So, as a slow burn effect, as you alluded to correctly there, Paul, it's a very, very powerful thing. And I think educating our patients correctly in this way is really the true value. And I think if you're clear and concise with your messaging, which you clearly are, I think your patients will come on board. And I think they're less likely to sort of want to go down that sort of overfilled sort of appearance, That's really, really good.
Absolutely. I mean, the thing you talked about, the destruction of the extracellular matrix as well, and reducing the reactive species helps that. So I think that's a key thing, really. But patients don't want to know about their reactive oxidative species or their MMPs or anything else. What they want to know is, if you inject this, is it going to make me look better? And the truth is, yes, it's going to take time, but it's going to last a long time, and it's going to look good, and you're not going to get too many side effects. And I think those are the key things to take away, really.
And the fact that you've correctly said, it's not just an opinion, it's evidence-based. So this is the important thing that patients need to understand, that you're not just using some hocus pocus type treatments. There's a lot of data to back this up, proper data. And so that's also very useful. Excellent. Really good. Okay, Bart, over to you.
Thank you for a great presentation and for the discussion. And now it's time to present to you Dr. Suk Basel, my beloved friend from Korea, and an outstanding scientist. Dr. Seo is the Master of Medical Science in Dermatology, member of the Korean Dermatological Association Board, member of Korean Aesthetic Surgery and Laser Society, board member of the Korean Society of Acne, board member of Korean Skin Laser Society, board member of Korean Society of Anti-Aging Dermatology, member of American Society of Laser Medicine and Surgery, member of Aesthetic and Anti-Aging Medicine World Congress. He will tell you about Juvelook as a skin booster, overall enhancement of skin quality, skin health, and scar treatment. The lecture will be presented in the form of a recording, but Dr. Seo is here with us. Welcome, Dr. Seo, my friend. And he will join us live for the question and answer session.
Thank you for wonderful introduction. Can you hear me?
Yes, of course, perfectly.
Okay, thank you. It's my honor to be invited with a great doctor, and I have been studying pediatrics continuously, almost 6 years, and it's very popular in Korea. So it's my honor to be present with you. And I send my recording because we have a time gap. It's 5 a.m. now in Korea. So I don't want to disrupt some communication. So I prepared my recording. Please turn on my recording now. Good afternoon, everyone. I'm Dr. Joseph Seok from Seoul and CHARLSON Dermatology Clinic. It is a privilege for me to join at this Zoom meeting. Thank you for inviting me. For over 6 years, I have been navigating the frontiers of dermatological innovation with tools like Juvelook and Lenisna. Today, I will unravel the mysteries of porous PDRA. Personally, through research and various clinical experiments, I believe that PDRA is not just a collagen stimulator, but a stem cell stimulator. This is my current career in the dermatology field. I have been working as a dermatologist for 26 years. This is my disclosure. I am involved in the development of new and innovative dermatological equipments. This is the agenda for today's presentation: basic science, preparation, complication, comparing collagen stimulators, and injection technique. From this point, I will present basic science. In PDRA, the carbon isomers D form and L form are alternately bonded, resulting in loose bonds between the molecules. PRLA consists of only L form, and the bond between the molecules is close, so it is firmly bonded. Comparing to PRAs, PDRNA is softer, has a low glass transition temperature, and remains in the tissue for a shorter time. PDRNA can be applied clinically in various ways using these properties because the glass transition temperature drops to 40 degrees from 50 degrees Celsius after hydration. We can soften, spread well, and promote particle breakdown by increasing tissue temperature. These properties of PDRNA can be used to increase the effect by combining with the energy-based device. The generations of PRAs, first generation is microcrystals of PRA. Second generation is solid ball-shaped particles with a thick wall due to the closely compact short chains of PDRA and a central empty space. Third generation is a foam-like reticular structure of PDRA with a thin wall and tiny pores containing about 80% airspace, allowing easy water penetration and different immune cell responses. Researchers found that third generation Juvelook Lenisna are very safe and convenient to use and show excellent results in recent studies. I compared the three PDRAs in the past. After mixing the saline and storing at room temperature, the round shape of a small-sized PDRA disappear after 3 months and break down much faster. Large-sized particles also break down faster than another company's product, likely due to the differences in the number of surface pores and water penetration. Clinically, this indicates that small particle PDRA does not cause significant issue if properly used in the dummies. The foreign body reaction caused by PDRA shows that giant cell increase only for 2 months and is decreased afterward. Immune reaction is not too aggressive in the tissue. These clinical photos show good clinical results using small amount of Lenisna and Juvelook in different locations and depths. A paper confirming photoaging improvement after repeated delivery of PDRA by needleless microliter injector Mirajet was recently accepted. Clinical photos show significant skin improvement without laser toning after Juvelook treatment. This is the result of the treating photoaged skin by injecting saline solution and Juvelook into half the base. On the side where Juvelook was injected with Mirajet, the tissue showed ECM regeneration, an increase in papilloidal fibroblasts, and melanogenesis was suppressed. From this point, I will present preparation process of PDRA. The information leaflet of these products suggests high concentration dilution using distilled water. But personally, I suggest more dilution using normal saline. Long-term room temperature hydration and mixing with the HA filler have several benefits. Sometimes you can use distilled water for rapidly separating the PDRA particles for quick usage, but need adding saline solution. I usually use 10 cc dilution for Juvelook and more than 14 cc dilution for Lenisna. I also mix soft-grade cross-linked HA, working as a lubricant, antioxidant, and separating the particles for Juvelook. Regarding hydration, the subcutaneous injection does not always require hydration, but intradermal injections must have hydration time. The injection layer of Juvelook is the intradermal area. Lenisna can be injected into the subdermal and intradermal layers both. Mannitol is an antioxidant with many advantages. I am currently using it for hydration to enhance the preparation. As your usage increases, please consider hydration with mannitol. This is my personal Juvelook mixing and hydration method. First, adding a lidocaine and 3 cc soft-grade HA filler. Then, fill it with a saline solution to make a total of 10 cc. Keep the mixture hydrated, ensuring thorough mixing and proper hydration for optimal effectiveness. This is a personal method, not mandatory. For hydration, make an amount to be used for 1 to 2 weeks at once. Store at room temperature for a few days, then place in the refrigerator. This operation of hydration softens the particles. In my experience, even if refrigerated for about 3 months, there is no effect on the denaturation of the drug. Hydrolysis by water rarely occurs in PDRA unless it rises to the body temperature level. Also, I have not experienced any biofilm or infection problems due to the long-term storage. Of course, it is important to mix safely. Perhaps the strong immune response caused by lactic acid plays a role in suppressing infections. From now on, I will talk about why side effects occur and how to solve them. The degradation process of PRA is affected by various factors, and it is increased by heat, moisture, pH change, physical stress, and radiation. When manually injecting Juvelook under the eyes, problems may arise if a large amount is administered. Therefore, it is recommended to inject it into the upper layer of muscle by spreading it with a cannula using a fanning technique, or to inject a small amount in microliters shallowly into the dummies using a multi-needle injector. However, this complication can be solved by repetitive applications of heating and strong massage therapies. A manual injection of high concentration and large volume can cause lumps. In this case, lumps disappear naturally after about a month. This is also a side effect of the same problem, so care must be taken when inject excessive amount shallowly. I usually perform shallow repetitive treatment using multi-needle automatic injector at periorbital area. These problems can be solved with heat and pressure massage without surgical treatment. The individual presented with a bulging condition subsequent to the over-injection of Juvelook below the muscle, while the resolution of this condition necessitated extended time duration. It was ultimately resolved. The treatment involved repositioning lumps toward the orbital bone by pulling down the skin, followed by application of RF heating and performance of pressure massage. Juvelook can be artificially decomposed very quickly, but need several sessions. In the same case, it can be solved with the heat and RF heat and pressure massage, but if it is left for a long time, it may take longer because the collagen is already formed. If you inject PDLA in a high concentration and large amount, it can cause a nodule. However, the side effects can be solved by heating, needling, strong massage, and a small dose of steroid injected into the area. But I don't recommend the high concentration 3 amps alone. This case was solved with several methods. I received this patient from another clinic. An informed beginner doctor accidentally injected high concentration Lenisna into the intradermal area. I treated this patient with RF thermal heating, 41 to 42 degrees Celsius, and strong pressure. I treated 2 times. I could solve severe lumps. Nodules formed due to the excessive injection of Lenisna. It can be resolved with RF heating and pressure, but it's difficult to treat where the bone that serves as a support is not located at the bottom. It's a difficult case because of bigger hard material Lenisna. In case of this side effects, repeated treatment must be performed for 2 to 3 months. The patient could not wait for a repeated procedure and had surgery to remove it. Multiple nodules occurred in a rheumatoid arthritis patient who received overdoses of 3 vials of Lenisna within 2 weeks from another clinic. Many lumps was reduced through RF heating, microwave, multi-hertz RF. Patients with immune disease should be cautious when using PDLA injection. From this point, I will present comparing collagen stimulators in animal study. In order to study the mechanism behind the clinical effects of PDLA, we conducted an experiment using PDLA and compared it to other collagen stimulators. It was a double-blind study using PDLA and another collagen stimulators. We injected 100 microliter of the substances in 5 areas in a 12-month-old mouse to compare 8 substances. A 12-month-old mouse is equivalent to a 50-year-old person. It is very, very difficult to regenerate the skin. We collected the sample 8 weeks after intradermal injection. Using mice that are too young to confirm the regenerative effect is not an ideal experimental method. The third generation PDLA demonstrated better effects in the regeneration of the basement membrane zone through the utilizing of PS staining. In terms of collagen regeneration, third generation PDLA exhibited a stronger effect. In terms of elastic fiber regeneration, the third generation PDLA also exhibited a slightly stronger effect. Lastly, in terms of hormone staining, type 3 collagen, type 1, type 1 collagen detection finding, the third generation of PDLA also exhibited a very stronger effect, more stronger purple color. After these experiments, we conducted an experiment comparing several collagen stimulators. Other collagen stimulators used to include common substances such as AJ Philip, KHA, PRA, PDO, PCL, PN, and Juvelook for CC dilution, Lenisna ACC dilution. We look at basement membrane zone on the 8-week sample using PS staining. Number 7, number 8 show increased staining. These findings are very unique, especially after injection of material. Other materials didn't show this effect. In this animal experiment, continuous UVB exposure and the protective function of PDLA on the basement membrane zone were observed. The study helps in the understanding how PDLLA can safeguard the integrity of the basement membrane zone under stress conditions such as UVB radiation. Despite the continuous UV exposure over 2 months, basement membrane zone remains most robust and intact in the treatment group compared to control group. This indicates that treatment, particularly with PDLLA, Lenisna, and Juvelook, have maintained the structural integrity of basement membrane zone under UVB stress, demonstrating the protective effects against the UV-induced damage. Under electron microscope observation, it was observed that even with the continuous UV exposure, single injection of Juvelook and Lenisna regenerate and maintain the lamina densa and hemidesmosome EM finding. This is the mass spectrum staining. Number 2, number 5 show slight increase in staining. The picture show a marked increase in collagen fiber for number 7. The last fiber staining, number 7 was the best. Horology staining, also number 7 was best. MMPs were checked for fiber degradation. After 8 weeks, MMP1 is a markedly decreased for HA, calcium hydroxyapatite, and PLLA. But MMP2, 3, 9 were decreased prominently for number 7 Juvelook. This shows the protection function from fiber degradation of number 7. For this reason, I added HA with Juvelook for reducing MMP1. These are fibrous marker findings. After injection of number 7, each stage cell markers increased not only in control, but also in comparison with other substances. The population of fibrous increase reduced scar response and showed the possibility of improving scar texture. In terms of fibroblast differentiation change, Juvelook showed the marked accelerating in the differentiation steps of fibroblast. In summary, Juvelook showed the best effect. However, sample number 8, Lenisna, did not exhibit such a distinct effect. Nevertheless, we adjusted the concentration and monitoring it over extended period. We adjust and reduce the concentration of Lenisna in a subsequent experiment. We used the 16cc normal saline dilution. Previously, we had used the 80c. We checked the specific adipose mesenchymal stem cell marker CD166. A prominent positive finding was observed using a low concentration at weeks 4. And on observation of basement membrane and low concentration of Lenisna at weeks 8 and 12 showed a prominent decrease in pH staining. Anyway, we return to Lenisna. The mass spectrum staining findings show prominent collagen fiber mount using a low concentration at week 12. An observation of barrel staining with low concentration of Lenisna shows a remarkable increase in elastic fiber even in older mice. An observation of horology staining, strong purple color showed prominent new and mature collagen fibers in low concentration. We're using diluted Lenisna. All kinds of parameters show excellent positive response at low concentration. Based on animal experiments, considering the area and thickness, approximately 5 mg of Lenisna in a 2 by 2 by 0.2 cm volume is the ideal concentration. Depending on the thickness of the skin, applying approximately 5 mg of Lenisna in layers at 0.2 cm intervals over an area of 4 square centimeter, resulting in the ideal concentration. Coronary fat regeneration has been confirmed in PDLLA in early animal experiment, and the article is progressing now. At a diluted concentration of 16 cc, a significant increase in the fat layer thickness, more than 150 micrometer compared to control, was observed at 4 and 8 weeks. Researchers will publish detailed data in the second half of this year. If sample adipocyte proliferation is possible, it would be a groundbreaking discovery. This video explains the subdermal injection technique. The fanning technique is very important. Last year, researchers published a new article about PDLLA, comparing it with PN and KHANNA. In both in vitro and in vivo model, the expression of heat shock protein VEGF was most pronounced in the PDLLA. This suggests that PDLLA particularly induces cellular stress response and vascular growth factor expression. Based on the high level of VEGF after Juvelook injection, we could observe the increases the reaction of migration, vessel tube formation, and proliferation of endothelial cell in the cell culture of PDLLA group. We can guess the PDLLA has the ability to make normal vessel structure more rapidly. Upregulation of TGF betas and collagen and reduced oxidative stress in fibroblasts were observed after injected with the PDLLA. And the increase of TGF beta 3 and type 2 collagen is an important signal in improving scars, and the more pronounced increase in PDLLA is observed in the tissue compared to other substances. The upregulated effect of PD-RNA on collagen density, particularly on type 3 collagen, blue color, and the mature type 1 collagen fibers, red color, is more pronounced in compared to that of PN and KHA. PD-RNAs stimulate angiogenesis, the process of forming new blood vessel, promoting the proliferation of the functional vessel. Understanding the differential effects of these materials of collagen regulation can provide a valuable insight into their potential application in tissue injury, wound healing, and regenerative medicine. Recently, an article about Juvelook has been published. The effect of PD-RNA on adipose-derived mesenchymal stem cell stimulation and proliferation was revealed. In vivo confocal microscope findings of the Juvelook injected mice show adipose-derived mesenchymal stem cell proliferation and differentiation after 4 weeks. The changes were more pronounced compared to HA injected mice. The blue is the nucleus marker, the green color is the adipose stem cell marker, and the red is the proliferation cell marker. In this experiment, the expression of mesenchymal stem cell by Juvelook was confirmed for the first time. This picture represents the theory of skin regeneration in aged skin. Through animal and cell experiment using Juvelook, researchers confirmed the proliferation of adipose-derived mesenchymal stem cell. Treatment of PD-RNA enhances the activity of adipose-derived mesenchymal stem cell, promoting tissue regeneration and repair. Various phenomena induced by PD-RNA greatly aid in scar removal and improvement. So, 25-year-old appendectomy scar showed a significant improvement 8 months after one single treatment of Lenisna with Milagen. This demonstrated the effectiveness of PD-RNA and needless injector. Scar can be improved through interleukin-10 adipose-derived mesenchymal stem cell, TGF-beta3, increased papilladomal fibroblasts, type 3 collagen, elastic fiber regeneration, and normalized angiogenesis. This is a vascular extent by HA filler, which was treated by Juvelook Lenisna. We can guess angiogenesis and collagen regeneration by PD-RNA. Considering angiogenesis and stem cell effects of PD-RNA, it could be applied to the hair growth as well. This is currently under the research. From this point, I will present the PD-RNA injection technique. I have several drug delivery tools. You are familiar with the needle and cannula, so I will focus on that. This is a method of diluting 13 to 15 cc of Juvelook and injecting into the dummies. It is important to massage the injection site well to disperse the particles after procedure. A small amount of highly hydrated PD-RNA is injected into the low dummies. Beginners should be cautious with this injection method. After injection, it is essential to massage thoroughly to ensure the drug spread well. Manual injection using needles are not recommended for beginners to use under the eyes or in the neck area. When starting the treatment of refractory melasma, injecting a small amount of Juvelook Lenisna into the subcutaneous layer with a cannula and beginning treatment can result in a significant improvement when combined with laser toning after 3 to 4 months. This is a method of injecting microliters using a multi-needle injector. Using a multi-needle injector allows for more delicate and even distribution of Juvelook, reducing intradermal pain and minimizing downtime. The shallow injection technique reduces the likelihood of nodule forming, ensuring a smoother and more effective treatment outcomes. The Juvelook can provide a significant help for skin that has suffered extensive UV damage. Automatic multi-needle is used a lot for regeneration. In order to inject Juvelook very delicately and densely, you can use an automatic injector. This can be adjusted to the shallow depth, cause less pain in periorbital area. This is a method of injecting 30 to 40 cc dilution of Lenisna into acne depression scar using 30 gauge 40 mm length needle. In order to distinguish the depressed area before treatment, writing is used to check the boundary, and marking with the GV to distinguish the depressed area is helpful during the injection. When treating acne depression scars, if Lenisna is manually injected into the dermis, excessive clump of particles can be suppressed by needling the region with a needle RF before or after injection. This approach ensures better dispersion of injected solution and enhances the overall effectiveness of the treatment. The recently developed pumping tip, another name is fusion tip, increases the sharpness and thickness of needle, so the tip further improves the delivery of the drug. The essential part of this needle is densely arranged between the needle space, so this needle can be vertically separated the dermal area and loosening the intradermal space and prevent the aggregation of the material which inject the Lenisna of Juvelook intradermally. infusion tip, pumping tip, often used for right treatment to deliver PDRA drugs for simple cosmetic purpose. Bioflux mono and bipolar energy transmission or under positive pressure, drug delivery can be applied topically, allows for more faster procedure. This picture shows an immediate response after treatment. Patient will feel very comfortable with this technique. This tool is called MONIKA. This device is a system that expels drugs at very high pressure and repetition rate and can be used for scar treatment and skin regeneration with Juvelook or Lenisna. This scene shows the treatment of stretch marks by injecting Lenisna using MONIKA device. This is the device called the double type, which sequentially performs the needle life and drug delivery. It is highly beneficial for skin regeneration. I will show you clinical cases. This patient received several treatments of HIFU from a different clinic, but she was still disappointed by the depression on the cheek and the aggravation of PIH. So I treated her with the PRA injection. It made the increased volume and was helpful for treatment of PIH. Another hyperpigmentation or melasma was improved. I combined with the laser and the brightening effect. Another view. Another case is injected with the Juvelook, with a multi-needle injector. Many body points improved. Light view. So for erythema, for an erythema is improved. Another patient. So smoothness of the surface. Another view. Acne patient was treated with a manual injection with a needleless injector. Another light view. Another patient. He had a rather short fraction later. It's not improved, but it's my technique showed wonderful improvement. Another angle view. Another patient show improvement of depression scar at the neck area. Another patient. So fine ice peak scar also improved. Another patient. Temporary area. Another patient. Acne scar. Another patient. Acne scar was improved. Extended scar also improved by my technique. Neck vehicle also improved by energy-based device with combination. From this point, I will present the needleless injector. This is the soft technique which causes no bleeding. I use this technique frequently throughout the day. I also use a needleless injector for more detailed, effective delivery of Lenisna and subcision in acne scars. And after needle RF, you can make automatic wide subcision more easily. For hair loss treatment, you can deliver very rapidly effective drugs. Most patients do not report any discomfort or pain during this procedure. This patient is showing smoothness of the skin surface after treatment. If you look closely, you will also notice changes in facial contour. The face appears smaller and the sign of tightening are observed. Another case, patient show marked improvement white pore on the skin surface. Another case of acne fitting scar, capital analysis, white pore, prominent difference. As my special treatment, straight sensor. Another case, straight sensor. Another case from another doctor, and this image showing good effect after Lenisna treatment by MONIKA. Another scar case. The micro-intradermal injection can improvement of lifting and tightening. The upward movement of pixel of the picture is continuously observed even after 5 months. Another case of lifting. Light view. Another case. Lifting tightening effect is made. Pixel was markedly moved. In summary, using a PDRA can make a wonderful effect with combination of energy-based device. So enjoy the result. Thank you for your attention and participation. We appreciate your time and interest in this presentation. If you have any questions and need further information, please feel free to reach out. Your engagement is valuable to us.
Dr. Seo, my dearest friend, massive thank you for your wonderful presentation. You dive deep into the secrets and all the points about Lenisna and Juvelook. Could you tell me what is the significance of the structure of the molecule and the composition of the product for the safety and effectiveness of the treatment? Could you give us, please, about 3 properties of Juvelook that have influenced it to be best skin booster in Korea for at least 2 years from now?
Thank you for your nice response. And This product is very popular in Korea because of this product has a porous reticular structure. No company now selling that product in the world widely. So it's in the Juvelook Lenisna has good tissue compatibility uh, with a strong change of pH about around the particle, and and can be directly injected to the dummies. That is good point for with a barrier device or manually, and and another point is its breakdown can be controlled with a different energy-based device method, and to enhance the effect or address the side effects, and that's a big difference. And it directly promote many basement membrane zone regeneration, inhibit the melanogenesis for brightening, increasing volume by stimulating adipocyte proliferation, and make it clinically very attractive substance. But response is slightly delayed. So you must wait about more than 2 months or 3 months. And so for compensation of that response, please combine some adding HA filler, and that is, but it's not mandatory. And this quality likely contributed to popularity in the very competitive Korean market.
Yeah. Thank you. Thank you, Dr. Seo. I would like also address the safety of the product. I just want to recall that Beauty Europe offers you a quite clear protocol for the management of any type of common complications after Juvelook and Lenisna, but they are really extremely rare. It's also extremely important for the everyday use of those products to use them the perfect way we advise you to do it, because one of the most important problems is the lower eyelid area, especially in the Caucasian race, and we really ask you for use the cannula for this area, and please do not try to do any manually injections, especially with needle in the lower eyelid area, because it can cause bumps and lumps. It's not so easy, but it's manageable to remove them. But it's easier to just start properly use this product. So use Juvelook, please, with cannula only in the lower eyelid area. It's also more convenient, especially for the patient, in a manner of comfort of the patient, to use mechanical injector. I also would like to recall you that we have a very interesting device. It's called RF convojector. That is a mechanical injector and a generator of radio frequency currents, so we can combine two different techniques in one session. Especially for Juvelook injections, we can do them intradermally and simultaneously pump the current, high frequency current, to improve the outcome and to increase the contraction of the skin.
Right. Usually, making undu is very good, beneficial for stimulate the stem cell and the immune cell, and they quickly respond to the stimulation. Then with the PDLLA, and PDLLA combined with the energy based is usually very good effect after treatment.
Yes, perfectly. Thank you, Dr. Seo.
Thank you
for your marvelous presentation. We know all the details about Lenisna and Juvelook. And now this lecture will be my pleasure to deliver to you. My name is Dr. BARTLOMIEJ SOBOLEWSKI, and I'm an aesthetic physician and a specialist of anesthesiology and intensive care. I'm also a member of Polish Society of Anti-Aging and Aesthetic Medicine. I'm also a masterclass trainer for Aptos, for Vivacy Stylage products, for Beauty Europe, of course, for InMode, for multifracts and different many brands of devices and products. I have 2 clinics in Poland, and I'm a founder of two clinics right now. And we are trying to develop many different new technologies to improve outcomes and to improve safety of our procedures, aiming for, of course, a natural look of the patient. So now I will present you Lenisna and its key to the natural volume of face. I will show you some procedures and effects of treatments, because we have observation from 3 years now on in Poland. Of course, far shorter experience comparing to Korean market, because they are leaders of aesthetic medicine in the world. But we have also some experience about Lenisna and Juvelook. So let's start with my presentation. Okay, can you see my presentation? Yeah. So let's start about Lenisna. We, of course, just to do a short recall, a brief summary for the perfect presentations spoken before. We are talking about the 3rd generation of polylactic acid. It's polydielectric acid with this spherical mesh structure inside particles that they are the safest possible right now to inject to our patients. What's more important, we get rid of carboxymethyl cellulose and we use non-cross-linked HA as a carrier. And that's the point. We can mix Lenisna and Juvelook with additional amount of HA. And especially in case of Lenisna, we can mix it with cross-linked HA with a filler to improve the separation of the particles. What's very important for the more safety, even more than the basic product. And we can also get rid of this gap, of this decrease of volume after injecting pure collagen stimulator after, for example, 1 or 2 months after the procedure. So if we use a combination of polylactic acid and HA filler in 1 vial or in 1 syringe, we can observe a better maintenance of the effect in a short and longer period of time. I would like also to summarize the effects of this product, but I think I should explain you the how to interpret this particular slide. If we will focus on, sorry, I have to go back. If we will focus on the young mice, and we see the structure of collagen and elastin, especially collagen in this staining, and we will focus on the aged mice, and after injection of polydielectric acid, the histological structure of the skin recalls the young mice, the skin of young mice. So it's really significant improvement in skin quality in aged mice. This is the most important conclusion of this particular paper. We know also, as Dr. Seo mentioned before, that it's not a collagen stimulator only. We are observing significant improvement in amount of stem cells, adipose stem cells, and adipose tissue. So we observe the increase of volume, not only due to injection of the product and collagen synthesis, but also the increase of volume of naturally visible face fat pads of the face. How to dilute? Just to summarize, please remember that we need to dilute it more to improve our outcome and to increase our safety. Lenisna for face 16 milliliters and Lenisna for body injections up to 20 milliliters. We can safely combine Lenisna with cross-linked HA, as I mentioned before, and I advise you to do it because results are far better in our patients. The paper shows, of course, the better outcome and the stronger collagen stimulation and adipose stem cell activity after higher dilution of the Lenisna. Another point is, if you compare those three slides, Mason trichrome staining is just general staining for collagen fibers. So we observe a huge amount of new collagen after injecting 60 ml concentration of Lenisna. The same we can observe in case of elastic fiber and Verhoef staining. It's very important for our patient because increase in elasticity of our skin gives us this phenomenal glow effect after this procedure. And very important, another point is that we observe a lot of new collagen fibers, but also, as we know, we observe a lower degradation of mature fibers of collagen in patient's skin. Remember that the aging process is a very complex problem. So we observe, of course, the decrease of volume of bone, of some kind of, or some parts of fat, especially deep fat pads. We observe a drooping of the skin, and we observe the loosening of toning of the muscles and the ligaments of the skin. We address injections to number 2 and number 4 and 5 layers of the skin. So we work in the safest layer of the face. It's the subcutaneous layer, of course. The fat tissue consists of no significant arteries or large nerves, so we can manipulate with cannula safely in this area. We also inject Lenisna into deep supraperiosteal layer to improve the volume, and to rebuild the volume. We observe that the loss of the volume in the elder patients. Very important part of our the target of the injection is prezygomatic space and deep piriform space. We can do injection of Lenisna in this area to compensate this loss of volume of bone in this particular area. Now I would like to focus on a few patients that are prepared. They underwent only one session of Lenisna. I picked this particular kind of patient because I want to show you single injection effects of Lenisna. The first patient is a young lady, aged 38, with some melasma and loss of volume. The second patient, aged 43. Then another patient with another loss of volume and deep wrinkles, aged 66. Very difficult patient to maintain, age 75, with a lot of deep wrinkles and hyperpigmentation. And one male patient with also loss of volume, aged 50, and deep wrinkles all over the face. So what's the protocol? I advise you to use 2 entry points. One in the zygomatic area, and we start with deep injections. Of course, the best way and the safest way to inject any product is to use with cannula, of course. But if you want to increase volume significantly, we can combine 2 different types of injections. We can start with HA filler to volumize, especially the anterior projection of the cheek. So we can do deep injections of HA, and then as a second step, inject Lenisna superficially, I mean in the subcutaneous layer. But if we don't want to use a filler, we start with deep injections into prezygomatic area with Lenisna. Of course, remember to dilute it up to 16 ml in the face injections. Then with the same entry point, we withdraw cannula and put it into the subcutaneous layer and do the fanning technique with retrograde injection technique, of course, to cover the mid-face up to preparotid area. It's very important to do injections in preparotid area to improve the tightening and lifting effect in the mid-face. Then, with the same entry point, we can turn the cannula up and do some deep injections in the brow line just to volumize this area to get this lifting effect in the upper face. And with the same entry point, we can do shallow injections in the subcutaneous fat tissue. It's very important to inject Lenisna in the subcutaneous fat layer because we know that it stimulates fat tissue to regrow and to increase volume in this area. So one entry point, the first entry point, covers the upper and mid face of the patient. Then we pick up another entry point. I usually do it in line with nasolabial fold and marionette line, just to easily insert the cannula upwards in those two areas. And we can start with deep injection, both with cannula or needle in the piriform space to volumize this deep area to improve the lip and to improve the volume of nasolabial fold, especially the static part of nasolabial fold. Then, again, with the same entry point, the second entry point, we turn the cannula up and inside it into the subcutaneous layer, just to slightly volumize or add a little bit of volume in the nasolabial fold. Then we turn cannula into marionette line and do the volumization of this area. A very important point is to do injections in the lower part of the face, especially in the jawline, but remember to use a very small amount of Lenisna in this area. We don't want usually to volumize this area. We just want to stimulate the collagen and increase the lifting effect in this particular area of the face. So with those two entry points per side, so 4 entry points, we can cover most aspects of the face, of the aging face of our patient. That's why I think this protocol and this product fulfill the needs of the patients to get maximum natural effect of the volumization collagen stimulation. Another important point is to use Lenisna in the neck, because usually when we use 16 or even 20 ml of the product, we have some product left. I usually combine Lenisna with HA filler, with 1 ml of HA filler, so I dilute it up to 20 ml. So I have plenty of product, and usually I use 12 milliliters for the face injections. It's 3 milliliters per one entry point, so 3 milliliters for the lower face, lower part of the face, and 3 milliliters for the mid face and upper part of the face. Then the rest of the product I inject to the neck, and a few drops I leave to inject in the dorsal part of hands. So it's very attractive for our patients to give them a very versatile, a very complex procedure, not only face rejuvenation, but neck rejuvenation and hands rejuvenation in one session. So let's focus on the youngest patient. She underwent only one procedure of Lenisna. So please observe this extremely natural effect, volumization effect of the face, especially in this oblique photo of the patient. We can also analyze the volume of the face. So we observed the significant increase of volume in the mid face and in the cheek. Another patient, quite difficult to manage, underwent also only one procedure of Lenisna. So we can observe a significant increase of cheek and marionette line volume, and also improvement in double chin. No one wants to have double chin, and if we lift the mid-face with Lenisna without threads or energy-based devices, we can get rid of the double chin as well. Now, in this picture, we can observe also a very important increase of volume in the cheek after only one injection of 20 milliliters of Lenisna combined with HA filler. Another patient, 66 years old, and one session of Lenisna as well. I always focus on such products that gives us extremely natural looking effect. So you can see that we improve the volume of the cheek, volume of the mid face. We have better jawline, and we significantly improve the quality of the skin. It's only Lenisna injections. There are no energy-based device, no lasers, no radio frequency. There is only Lenisna injection. As well, we can observe a really significant increase of volume in the mid face after Lenisna injections. And another lady, age 75, very difficult patient to manage. Also a heavy smoker and a lot of tanning in the history. And that's the effect of Lenisna injection. Perfect volume and really incredible improvement in skin quality. Of course, it's very difficult to get rid of all those deep wrinkles, but please look how well she looks. And again, the volume analysis of Quantificer give us the opportunity to compare volume of the face before and after. And another patient, aged 50, with loss of volume as well, a typical aging process. In this case, I use non-ablative fractional laser as well, just to get rid of this hyperpigmentation in this patient. But this is the effect after 3 months of one session of Lenisna. And in this case, I've analyzed the lifting effect. Please observe how strong lifting effect without radio frequency or thermal lifting or threads can we achieve. So some take-home messages just to summarize all the lectures that we heard before. Remember that PDLA, Lenisna and Juvelook is something more than only collagen stimulator. It's a third generation of PDLA product that opens a new category of aesthetic medicine products. We know that we have a lot of new scientific data and many cellular mechanisms. And we know that PDLA is far more safe procedure comparing to other previous generation products. We know that we observe a new collagen fiber production, new elastin fiber production. That is very important because I think it's one of the most potent elastin stimulators right now on the market. We've discussed a lot about angiogenesis and reactive oxygen species removal or elimination, which is a very important mechanism of anti-aging activity. The macrophages modulation and adipose stem cells stimulation is important to rebuild of volume due to growth of fat tissue. And another point is decrease in degradation of matrix collagen. It's not only collagen stimulator, but it's some kind of protector of matrix collagen in our patients. A lower concentration shows much better results, of course, so we advise to use 16 mils for face and 20 mils for body, and we can safely combine Lenisna with cross-linked HA filler. Please remember the injection techniques. Lenisna can be used both with cannula or needle. We advise to use cannula as a basic technique with retrograde injections. For Juvelook, in periorbital area, please use cannula. Don't try to use needle. In case of mesotherapy, one of the best options is to use mechanical injection. If you want to use hand-made injections, please dilute Juvelook more and combine it with non-cross-linked HA to stabilize the solution. Of course, we know that PDLA affects many aspects of face anatomy. We can observe a deep volume rebuild, mid and lower face lifting effect due to new collagen and elastin synthesis. We can observe subsequent double chin reduction due to this lifting effect in the mid face. We observe in all the patients global skin rejuvenation. We observe the reduction of the deep wrinkles and overall natural younger looking effect. PDLA is, of course, extremely versatile product with many indications. The basic one is, of course, the volumization of the face, but please remember of all the body procedures, remember that this is a very potent skin rejuvenator. It has lifting effect. It's one of the best strategies for acne scar reduction, as well as post-traumatic and post-operative scars. We observe high efficiency of enlarged pores reduction, stretch marks, and what's very interesting, if you inject Lenisna in body protocol in subcutaneous layer, we observe very effective cellulite reduction. Thank you for your attention.
Nice lecture. Thank you for nice lecture. And I have you showed a wonderful effect. It's much better than me. Wonderful, amazing result.
Thank you.
And I have a question. Looking at your 3 years experience working with the Lenisna and Juvelook products, what did you this product give and what opportunity did it provide in your daily practice? I want your real situation.
Yes. Well, it's the most important point is that the versatility of this product, because using both Lenisna and Juvelook, we can address many different indications in a lot of patients, male and female, young and older patients, and we can treat many aspects of the aging process in one session or in 2 or 3 sessions, as we advise to do, but not only volume effect, it's also skin quality improvement, it's lifting effect. We can decrease the cellulite, we can volumize buttocks, we can contract the skin of the belly. So the versatility is, I think, the most important aspect of this product, and the safety. We rarely observe serious complications. I haven't seen any vascular occlusion after Lenisna and Juvelook. I think it's very difficult to get such a serious complication with Lenisna, because due to the small size of particle. Yes, it's a wonderful product. It's difficult to compare it to any other product available right now on the market regarding of all those aspects we discussed in these lectures. So yes, there is nothing better than Lenisna and Juvelook right now.
Yes, wonderful, wonderful. Thank you for your nice lecture. Yeah.
And now the final lecture will be led by my friend, my colleague from Poland, Dr. MONIKA KRET, who specializes in the application of hybrid collagen stimulators and the body, and achieves spectacular body contouring results, which she will soon share with you. She also had the opportunity to discuss this during the exceptional Jupiter conference in Korea in Seoul last year. She's also a masterclass trainer in this field. So, Dr. Monika, the floor is yours.
Thank you, Bartek, for the warm welcome. And thank you for everybody who is watching us for staying up for so long. It's almost 11 p.m. here in Poland, so I hope it's not going to take for long, but I have some really good examples to show. So it's a huge honor for me to be able to perform in front of you. I am excited to show you my results, like results of my work. I work on Lenisna for over 2 years, I guess. And right now I focus more on the body contouring. But what I really would like to admit is that I'm very glad that we have entered the era of natural beauty. As the professor said at the beginning, it's really important for our patients to look like themselves. So I've been looking for a long time to find a product that is going to give me this natural look, that is going to give the skin of my patients this healthy, still again natural looking view. And I feel like we tend to inject too many hyaluronic acid to our patients. So let's see what we can do with Lenisna on the body. We've seen on Dr. Bartek really great results on the face. And here in the video that I'm going to show you, it's like a quick review of how I administered the product to the buttocks, because this is actually the point that I'm going to talk about. So for the patient, I administered 2 ampoules of Lenisna. Each I dissolve in 90 milliliters of sterile water and 1 milliliter of lidocaine. I firstly mark the places which I observe lack of volume. Then I analyze how it's going to look when the volume is going to be bigger. I numb the injection site with cream or lidocaine. Then I administer the preparation. I used at the beginning to mix it 20 milliliter syringes, and I mix it in hand after obviously mixing it on the vortex for 30 minutes. And then I use 2 10 milliliter syringes, and mostly I work with 22G cannula 17 millimeters, because as Dr. Paul said, it's just easier to cover bigger areas of the buttock. But it also works well with 25G. So if you feel like doing with this one, obviously you can. So on the first session, I mainly work on the outer upper parts of the buttock, and obviously it also depends on the patient, because sometimes if they complain more about the dimples or the hollows, like in the middle of the buttocks, then sure, we are going to do this at the beginning, because in this way also patients are going to trust us somehow if they see results. But I really focus on the first outer upper parts, because in this way I can see that the buttock is going, like it's lifted. So this is like a first step of the procedure. I usually do 20 milliliters on each buttock, 3 months interval between procedures, and it depends on the case. Sometimes after one you can see the result. But if you want like this effect to stay for long, and if you want the big and really good looking effect, then I advise 3 procedures. Okay, next slide, please. Okay, so this is one of my favorite metamorphoses. But it also required a lot of work from my patient. She's 30 years old, so it's a really young patient. She wanted to firstly to make the vision of this postural defect to disappear. So as you can see, her left buttock is smaller than the right one. So our point was to make them symmetrical. And I think after the 3rd procedure, as we can see, we have the result that we wanted. She's working out a lot, as you can see as well. Really good looking skin. So it was just to voluminize the buttocks plus this postural defect to change. 40 milliliters on each session, just Lenisna, 3 months interval, and at the beginning, upper outer quadrant of the buttock. So next slide, please. Here is the lateral part. This is the left buttock, which is smaller, but still we can see some kind of a lifted effect on the lateral point. And the next slide is going to show us the right side, which is obviously looking better because the postural defect is in this way, so that she's shifted to the right, right? So yeah, okay, and another one. Just not to show you only young patients, I'm going to show you mature patient. This is 57 years old female. Her purpose was to look good when she's going to the beach. So mostly she was complaining of her stretch marks and this visible dimples in the middle of the buttocks. So as you can see, before the procedure, then 3 months after first procedure, where I administered 20 milliliters of Lenisna on each buttock. And then we waited for 3 months to do the second procedure, as you can see on the very last right picture. And the next slide is going to show you the left buttock. In my opinion, like it's really incredible. The differences are real. She's almost 60. She's not going to the gym. Obviously, I told her to, but this is a lady who doesn't want to train. So I think even though her lifestyle isn't that healthy, we see really good results. And the next slide, please. Here is her lateral part. And this is interesting because here you have before picture and right after second procedure, but on the last picture you have 6 months after second procedure, and she lost 5 kilos of her body weight. And as you can see, her buttock, her skin looks really smooth. I wouldn't even say that the patient is in this age, is 57 on the picture, on the last picture. On the next slide is going to show you the right buttock. Like, of course, the differences are in the light, but the smoothness is real. So I'm really proud of this metamorphosis, and I'm pretty sure it's not going to be our last session because she wants more. Okay, the next. And here the before picture and the 2 months after second procedure. So you can observe like the total buttocks look. Yeah, okay, the next. This is again her after 6 months. Okay, and this is my patient. She was some, I don't know, probably practitioner, but I'm not sure, who gave her Ozempic, and she lost, I guess, 15 kilos. Yes, I even wrote it. Yes, 15 kilos of body mass in 5 months. I mean, I will skip the part of administrating this medication for this patient, but what was her problem? It was completely lack of muscle of anything on her buttocks. So we tried our best to help her, and you can see 1 month after second procedure how the skin has like more volume. Obviously, it's not going to give her like effect after implantation and implant, but still it looks better than the previous picture. And the second slide. And here is the left. Here I focused on mostly on middle part, but like I wanted to cover the whole buttock skin just to help her skin somehow to rejuvenate. And the next slide. And as I said at the beginning, I usually administer 20 milliliters on each buttock because I believe in this way my results are the best. But here it's really good looking buttocks, in my opinion. But my patient concern was this little dimple that you can observe on the left picture. So I just decided to give her one ampule, which was 20 milliliters in total. I divided into 10 on each just to improve skin texture. And I think it looks well. Okay, the next. That's her lateral part. And again. And this is interesting patient because this patient, she's 38 and previously she was injected with hyaluronic acid, almost 20 milliliters. It wasn't in my clinic, but she came to me because her appearance, appearance of her buttocks wasn't successful. We could see visible hyaluronic acid particles. So I dissolved as many as I could. And then I wanted to somehow cover it because it was impossible to dissolve everything. Plus, she wanted to have really volume, like huge volume of her buttocks. So that was the problem, because obviously if I would dissolve everything, then the volume will be really would be smaller. So what we did was we injected almost 30 milliliters, I guess, on each session, on each buttock. And on the second slide, please. Here you can see what I'm talking about. I hope you see. On the left side, you can see this irregular texture, which was actually due to hyaluronic acid. But on the right side, after dissolving and after emplacement of Lenisna, I think it looks really well. She was really happy, and this is the most important. Yeah, so we can actually combine, obviously, as Bartek said at the beginning, we can combine, and I do it as well, and I will show you. I combine Lenisna with cross-linked hyaluronic acid, but I do it in one ampule. But here I cannot tell you who did it and how it was done. Okay, so the next slide. And this is the patient from the video at the beginning. She's 34, and the video was after that was our first meeting, and this is her result after 3 procedures. On each session, I administered 40 milliliters of Lenisna. And again, 3 months interval, because I always try to ask my patients to not come earlier than 3 months, even though they're coming after 1 month because they want more and more. So this is her right side. And again, second slide, please. And this is lateral, this is her left side. But what's important here, and I hope you see it because I'm not sure if the quality is good, but like on the left side, we can see stretch marks and a little bit of cellulite. On the right side, after the 3rd procedure, there is no stretch mark. Like they're completely gone, which is really amazing. And that's why I love the product, because even though it gives you volume, and it actually works well also on stretch marks and cellulite. And the next slide, please. And here we have her before, right after 3rd procedure, and this is her 1 year after procedure. So still looking well. She lost some weight probably, but the smoothness of the skin, the volume effect still is there. And I think this is actually the proof that this product works really well. Okay, again. And this is another patient from the lateral view. You can see how the shape of the buttock changes. We can see this really round, really good looking shape after 10 milliliters, because this is 1 ampule divided by 2. Okay. And this is my latest patient. I think she was in my clinic around a month ago. Her really huge problem is the two different buttocks and huge hole on the left side. This is her anatomy. Nothing has happened here. We just can see how anatomy can change, can be different. And what we did, we actually gave her 20 milliliters on each buttock, plus I gave 1 milliliter of cross-linked hyaluronic acid. And as you can see on the right side, the right buttock almost is complete. It looks more rounded, but the left one, due to this hole, needs more of the product. But what I do usually, if I know that we are planning 2 or 3 procedures, at the beginning I always give the same amount of product on 2 buttocks. Then on the second, and I will administer more on her left buttock and less on the right side, so to make this symmetrical appearance. And the next slide. And here is a patient which is 48. She trains, I think, 5 times per week. So as you can see, her before picture is really good. And her age, I'm really proud of my patient that she take care of herself so well. But she wanted a little bit more of the volume and skin texture. You can see these little holes in the middle of her buttocks. So that was the area that we wanted to cover. Plus this outer layer to obtain this roundness when you look at her from the front and the back and the lateral side. And we administered again 2 ampoules and 1 milliliters of hyaluronic acid cross-linked to both of her buttocks. And on the next slide, you can see her side view. And again, beautiful appearance, this roundness visible on the upper side of the upper point. And I think we're gonna plan some more because I know that this patient wants a big volume. So yeah, and that's it. What I can tell from my experience is that this product works really well. It never give me any problems with the skin, the nodules for this up to this time. So what can I tell you? I mean, I'm in love, and I work a lot on body contouring, and I believe that we need to focus more on the on bodies of our patients instead just on their faces.
Dr. Monika, thank you. Massive thank you for your perfect presentation. It's really astonishing results. So I've got one short question. Could you please mention a few tips that should be strictly followed when performing treatments on the buttocks or other parts of the body?
As you said at the beginning of your or in the middle of your presentation, I think what we should do for the first point is to follow company recommendations. And this is really important because I know by myself that I tend to mix few things just because I try to find another solution for my patients. But we can do it with hyaluronic acid because we know it for a long time. But here, I'm telling you not to avoid and always follow the company's recommendation. And again, what's important to mix the Lenisna on Vortex for 30 minutes, not less. I think this is important. And to work, when you insert the product, always mark it well where you want to insert the Lenisna. Again, try to form a fun when you're working and make many passes with a small amount of preparation. And I think this is the key of the result.
Yes, and examine the patient in the upright position just to.
Exactly. Yes, as I show it on the video, never on the laying position because it looks totally different.
Thank you, Dr. Monika. It's astonishing how you perform perfectly in the body contouring. Thank you again.
Thank you so much.
We finished all the lectures. Thank you, massive thank you for all of you to keep with us till late. And now it's time for Q&A.
There are so many questions.
So,
and can I mention?
Yeah, of course.
Yeah, so Dr. Anastasia Romanesco, right? And he is he or she? Romanesco. It's I don't know. It's doctor mentioned about the vascular accident of this PDRLA, and he inside the article already write his question. It's vascular accident. Several vascular accident is reported in second generation product PDRLA. Second generation already mentioned the solid hardball. It's a big size, bigger than this Lenisna and Juvelook. Juvelook is much smaller. And recently, one article reported that the vascular accident of PDRLA, Lenisna, but at first time, during the 2 weeks, some visual loss was detected. But after that, patient returned to normal condition of visual field. It's a very interesting article. We don't know the reason, but maybe the particle was very small and disappeared very quickly, but the damage time was very short. So patient returned to normal visual accuracy. But some small particle may be the main reason of that accident. But it's very weird. The response was detected. And the personal experiment of animal study, vascular occlusion by this product is very chance is very low than another product because the size or passage is more soft, and that soft character is the main reason for low chance of vascular accident. So we must all of our product have a chance to make vascular accident. So be cautious, and gentle injection is a very important part of all of filler esthetician and the doctor. So that article you can ask to the company, and okay, my mention. And
All right, so let's address all the questions. Let's start from the beginning. It's a question for Professor Bob KHANNA. Thank you for your lovely presentation. Just wondering, what are your thoughts on using exosome polynucleotides and amino acid replacement therapy to stimulate collagen?
I've had a lot of experience with certainly the polynucleotides and also exosomes more recently in the last couple of years, both plant and animal derived. I think all of these things have a place. I'm a great believer of collagen stimulation per se, and I'd add also one of the things that we of course, due to the remit of this webinar, we haven't really discussed is the fact that nutrition plays a big part in all of these things as well, right? So we can actually optimize the surroundings, the environment for collagen stimulation, so we can essentially leverage and capitalize on any of these treatments. What I'm saying is that if we are using any such collagen stimulators and optimizing our health in the background, you can imagine we're going to have an even better result. So I think as physicians, we should really focus very hard on looking at a three-dimensional approach to these things, not just looking at what can we inject into somebody's body or face. Let's look at actually optimizing them from a health standpoint, and then our results will get even better. You know my saying on this part, healthy people look better. It's very simple. And so, you know, to answer that question in particular, I think, you know, everything has a place, but, you know, as long as you understand how to use the products to their full potential. And what you've seen in this webinar is you've seen some very expert opinions with regard to both face and body being used in a very, very strategic fashion, protocols being adhered to in terms of dilution, and also applications, very, very robust techniques so that they are predictable for anybody to follow. And that's the point. It's not like just a haphazard fashion. It's a methodology that, you know, people that are new to this industry can follow and achieve very similar results. And that's, I think, the big message that we need to drive home.
Yes, thank you. Another question to you, Professor. According to your practice, what is the preferable collagen stimulator? PLA, PDLA, PCA with the least complications?
That's an easy one. Well, PDLA.
Yeah. Yeah.
That's easy.
Another.
And by the way, I mean, I come from a very, you know, remember I started my aesthetic journey in 1996. You know, I qualified in 92. I started aesthetics in 96. So, you know, I still remember in the early days, I mean, not 96, but certainly in the late 1900s, sorry, not, up to the 1990s, I'm saying, up until the 2000s when sculpture, for example, you know, was making the rounds, and all the talk about different dilutions and what have you. So, you know, I've seen a lot of products come and go. I know sculpture's still around, and obviously lots of these other types of products, but it's interesting how things have been modified over the years in terms of even those products. Sorry,
Yeah.
you were asking me another question. I rudely interrupted you. Tell me.
It was the easy question about the least complications, so we know that Lenisna is the best. Yes, and the safest one.
Sure.
Another very important question, I think, to all of us, how can PLA be reversed in case it's wrongly injected? I think the best way is to avoid wrong injections, to do all the injections according to our proposal, our strategy of injections, because they are based on a lot of experience from all over the world and a lot of discussions. So we know how to safely inject Lenisna and Juvelook and how to avoid complications. Yes, but it's impossible to directly remove PLA through any kind of injection. We can decrease the body response with use of local steroids, long-lasting steroids. We can use radio frequency in the very first stage after the injection when there are visible deposits due to the glass transition temperature and when we heat up the area with polylactic acid, we change its properties. It's more plastic. We can disperse it easily after heating up, just to decrease the lumps. But it's very first stage after the injection, up to 3 weeks maximum. So that's when we use radio frequency. Another very important question: what collagen does Lenisna and Juvelook stimulate, and is there any studies to back it up? And how can Juvelook be combined with other treatments such as Synecus, Profilo, exosomes, polynucleotides? How would you space each treatment, and in which order? The best to say is, if you start using Juvelook, you stop using other products usually, because it's really the best. So it's easy. Yeah.
Yeah.
Okay.
Yeah,
So,
can I mention? Can I mention? It's
of course.
actually is a P. I already showed the result of PN and KHA comparison. So PN has very actually regeneration power is very weak, and actually I don't need to combine. Why we combine PN to regeneration? Actually, for early stage of wound, we can combine the PN, but for real regeneration, we don't need the PN.
Yes, of course.
And
Thank you, Dr. Sell. Another question, do you have any side effects and superior features of third generation collagen compared to autologous treatments such as biofillers, exosomes, and adipose-derived lipofillers and stem cells? It's a good question. Of course, if you want to achieve a significant increase in volume, for example, in buttocks, one of the best strategies is to do fat transfer, of course, or to do surgery. But if we consider the easiness of the procedure, you just grab 2 vials or 3 vials or 4 vials, 6 vials. It depends on the patient, and you just inject after 30 minutes of mixing, and you are done. If we compare it, for example, to fat transfer, it's quite long procedure to collect the fat and then to inject, and we can compare those results. I mean, results after fat transfer and after Lenisna, and I think Lenisna is a very important competitor for low volume fat transfer. Yeah. Comparing to other fillers, it's different mechanism. Filler is just a filler, it's fluid liquid implant. Yes, so we inject it and we just get the volume. In case of collagen stimulators, we get volume through the regeneration and rejuvenation of the tissue and production of native own patient's collagen. So it's completely different way of getting volume.
Yeah, I think the thing I would say is it's a much more natural effect.
Yes.
I think patients want to know that you're going to get a much more natural, gradual volumization. And I think people are often concerned that they look like they've had something done. So if you have a natural thing, it takes time. So people don't realize they've had some treatment. So I think that's a win, really.
Yes,
Yes.
thank you.
and can I say?
Yes, of course.
Yes, researchers studied the real situation of adipogenesis. I showed the early data of adipogenesis in the animal. We usually think about volumization in patient. Usually said that collagen regeneration, but it's a fat area is a collagen regeneration not ideal for volumization because of fat that can make a fat atrophy, fat destruction. That meaning is destructive condition. So we need a more real regeneration of adipose cell. So we found that some appropriate concentration can stimulate the stem cell, and stem cell can also change to adipocyte.
Yeah.
Yeah. So some condition we can make a firmness by collagen regeneration. Some condition we can make a real adipogenesis.
Yes.
So that is dependent on the situation. We control the concentration and depth and amount. Energy-based device combining can change the many situation.
Yes, thank you, Dr. Sell. Another question is about the use of PDLLA in rosacea patients. The rosacea is the best way, from my point of view, is to use energy-based devices to decrease the structure of the vessels and the amount of the vessels in the skin. So usually I use intense pulse light devices to decrease the erythema, and some therapy, I mean some topical creams designed to decrease the symptoms of rosacea. I think there is no paper right now about improvement of skin quality directly in rosacea patients. So
Yeah, right. Can I say?
yeah, of
Yeah,
course.
it's in Korea we have a lot of experience of combining of this material to treat rosacea, and
Okay.
actually many situation is symptom is much better changed much better with combined vascular laser, and so treatment interval and duration or relapse chance is much reduced with combining this drug, because it's angiogenesis. We published the angiogenesis article. Angiogenesis meaning is not a ectatic vasculature increase. This real healthy condition of vasculature is made. So
Yeah.
circulation is improved. So I showed many cases of redness improvement in the many patients. So you can increase the effect of combining this product with energy-based device to treat rosacea. But it's article is not made yet. Yeah.
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 Another point is to combine Juvelook with small amount of botulinum toxin as a
Right.
mesotherapy. I mean, mesobotox.
Yeah. Yeah.
Just
Right.
to improve the outcome of
Yeah.
yes, rosacea treatment. It's another strategy for rosacea treatment.
Yeah.
It's Juvelook with
With
botulinum toxin. Yeah.
Would you mix those together though, or just
Yes,
do
of course. In one,
treatments?
in one syringe, 20, 30 units of Botox. Yes, you can combine it in one syringe and do the mesotherapy. I usually divide Juvelook for 2 different syringes, one with botulinum toxin, one without, and do the combination of botulinum toxin and Juvelook in the erythema area and the other parts of the skin. I treat with Juvelook only.
Yeah.
So, yeah, that's
I
a
must
strategy.
admit, I've always done it as a separate treatment.
You can mix it in one syringe. Yes. How do you go about dealing with a nodule? How long does a nodule can last for? Number one fact, most of the nodules will disappear spontaneously in time, most of them. But in the very beginning, in the first 3 weeks after the treatment, if something went wrong, we can use radio frequency to hit up this area and do this strong massage just to disperse this, dislocate this product evenly in the subcutaneous layer, so it decreases the nodule. If the nodule is older than 3 weeks, we can use saline to just explode it, to destroy it, and after a few months, if we observe a nodule, I think the only strategy we have is to inject steroids into the lesion. How often the allergic reaction occurs to a patient? I haven't seen any allergic reaction to Lenisna and Juvelook. Maybe we can observe from time to time allergy to local anesthetics, but in this case we can use normal saline and avoiding dilution with water, steril water for injection with lidocaine, of course. So this is the protocol for patients allergic to local anesthetics. But I haven't seen any allergy to PDLA. Which skincare brands does Dr. Bob use? Professor.
Well, that's an easy one. That's a very, very easy one. I have my own brand, Dr. BK Skincare. So
Yeah.
go on my website, and shamelessly I'll plug that. But yeah, you can go on my website and you can feast your eyes on. That's one of the things that I'm religious about is my skincare. That's it. That and a bit of toxin for me personally. But certainly I'm a big believer of stimulation of collagen, like I said to you. And I think the combined efforts that we've been talking about definitely have I think are the future. There's no question about it.
Another question, can we change the amount of product Juvelook for lower eyelid to more than 1C in some cases? Well, yes, but I think the best strategy is to do 2 or 3 procedures with 0.5 ml per side, then inject a lot of product and worry about nodules. I think it's the safest way to manage this procedure. What are the side effects of Lenisna and Juvelook? But I think we discussed a lot, and Dr. Seo showed us some problems, and we discussed previously. As you know, the choice of product depends on the patient's needs, treatment goals, and skin type. I would like to understand the specific treatment protocols for Juvelook and Lenisna. What is the recommended interval between treatment sessions for each product? How many sessions are typically required to achieve the standard expect improvement for each product? It's a good idea to keep quite long intervals between injections, up to 3 months, both in case of Juvelook and Lenisna. And we usually do 2 or 3 procedures of Lenisna and 2 or 3 procedures of Juvelook in time to get best results. Of course, we can consider combining with high energy devices like radio frequency or my beloved non-ablative lasers right now, fractional lasers. I love a combination of erbium glass and thulium lasers, especially in one session to improve the outcome. Yeah, so I think that's the best strategy. Question to all of the speakers: do you have the experience combining Juvelook with HIFU? I mean, high intensity focused ultrasound. And what is your opinion about the outcome of combining these 2 procedures? Thank you. My personal opinion, if we consider the future of the patient, so if patient plans to do a major surgery, I mean the plastic surgery, the lifting strategy in the future, I think we should avoid HIFU procedures due to the I think the highest risk of deep scar formation in the subcutaneous layer. If we speak with plastic surgeons, they almost hate HIFU in case of a high amount of difficulties in the preparation of the tissue after the high intensity focused ultrasound procedures. So it's my personal opinion based on the different opinions of experts in plastic surgery. So that's why I usually avoid this machine or this device in my practice. But how about our experts? How do you, what do you think about combination of HIFU and collagen stimulators?
I've got HIFU, but I've not used it really with Lenisna or any other collagen stimulator. Really tend to not do that. Really.
Okay.
I can't think it's there's any particular reason why you shouldn't, but I've just not done that. I much prefer RF microneedling really with it.
Okay, thank you. Can PDLA cause vascular occlusion? If yes, how are we to go about reversing it? We haven't ever seen vascular occlusion after Lenisna or Juvelook. Juvelook is extremely safe, even theoretically injected intravenously or intraarterial, because the diameter of the particles is smaller than microcirculation. So it will pass through the microcirculation, and the shear force during the injection will even strongly diluted during the injection. So it acts not as like HA filler injected into artery. So we are quite safe about vascular occlusions in case of Lenisna and Juvelook. Another question: what volume of Lenisna is recommended for the forehead? Thank you for your answers. Forehead is quite challenging. I know that I think we should address this question to Dr. Seo, because in Korea it's very popular to inject collagen stimulators in the forehead area, as far as I know. So Dr. Seo, what do you think about the volume of Lenisna in forehead augmentation or volumization?
I like a soft treatment, so I prefer to multi-passage of multi-needle of Juvelook can make volumization, but it need several session. But if you want one session treatment, 20 cc, 16 cc more than diluted Lenisna in subcutaneous area is appropriate location, but need some full dissection is needed for before injection. So
Yes.
small, but needed some waiting time for real volumization for simple Lenisna injection. So please combine with the other product to immediate result.
Thank you, Dr. Seo. Another question, I think very interesting. Can we use other agents except lidocaine to dissolve the product? Septanes, ubistazine, and other brands in case of allergy to lidocaine. I'm anesthesiologist, so I use a lot of different local anesthetics. And please remember that lidocaine is the safest one in case of intravenous injection. It's antiarrhythmic drug, so we can inject it, and we inject it intravenously. So that's why we advise to use lidocaine as a basic local anesthetic in everyday practice because it's the safest one. Bupivacaine or ropivacaine, mepivacaine are more dangerous in case of any complications, especially arrhythmias and other problems. So if patient is allergic to local anesthetic, just pick up the normal saline and do the dilution with normal saline. That's all. Question for Dr. Monika. What would be your approach to deal with nodules on the buttocks area in case it happens? And is there a risk of causing death? Death? When performing the treatment in the buttocks? Okay. Very hard questions.
I mean, you must remember that when you touch a patient, you always have to take into account that the complication can appear. I mean, and I think I'm gonna answer like this, and that's it, because yeah. For the first question, I think Dr. Bartek answered well what to do in case of nodule. If they appear on face or on the buttock, doesn't matter. It's the same thing. Either we use radio frequency, or we inject normal saline into the nodule under the ultrasound, and I think it works well. But I've never observed nodule in buttocks up to this time when I work with my patients. So I know how to deal with nodules, but I've never used these things.
Another question for cheek volumization: in which layer would you do Lenisna injection, subdermal, subcutaneous? We do injections in 2 layers, as I mentioned. The first injection is deep plane, I mean just over the bone, just to do the especially anterior projection of the cheek. And then we move to the subcutaneous layer into the subcutaneous superficial fat and do the fanning technique in the midface. So this is the basic strategy. You can replace the deep injections of Lenisna with HA filler, strongly cross-linked for get greater anterior projection and to volumize cheek more. What's the cost price per vial and average retail price per treatment for the facial treatment for both Juvelook and Lenisna? So I would like to ask to address this question to our friends from UK.
Well, it depends. I mean, costs are around 180, I think 189 a vial, something like that. It depends on where you are in the country, I think, in terms of pricing. So, I mean, probably something like Teardrop will be about 250 a time. Lenisna is around 450 a vial, something like that, maybe a bit more in London. But you know, you have to look at your market and you know how long it takes you and your profit margin really. So it's not easy to give you an exact figure, but that's a sort of benchmark I would suggest.
Thank you, Dr. Paul. Another question: what is the immunological difference between second and third generation PDLLA? Any experience with combining Lenisna with fat transfer and Juvelook with SVF? I think that there is no big difference in biochemical and immunological response because it's just foreign body reaction. The point is the construction, the physics of the particle is different. I mean, the second generation is just a round sphere hollow inside, and the third generation is mesh-like, and it gives you a stable pH around and a stable, long-lasting collagen stimulation. That's better. And we get rid of CMC that can cause the aggregation of the particles. And if we use HA, we get rid of this risk of aggregation and long-lasting nodule formation, granuloma especially.
Technically, the methyl cellulose that you have in type 1 there's a bit of a scum that forms when you make it up, and that can block quite a lot of small cannulas. So that's another advantage with Lenisna and Juvelook, is that you don't have that scum. So it's much easier to inject and you don't get any blocking of cannulas.
Yes, we don't have used 5,000 needles per one procedure.
Yeah, right. You don't squirt half of it on the floor either.
Can I say? Can I
After
say?
30 minutes shaking, can we keep the product in room temperature for some time? How soon do we need to rush it to fridge? You can keep it up to a few days, but usually I put it immediately after composition in the fridge. I mean, everyday practice looks like that we don't have to put this product into the fridge because we use it immediately after the preparation. Because, for example, for Juvelook, we can put some topical cream for the patient, wait 30 minutes with this cream, and in the meantime, we prepare the Juvelook. So there is no problem with putting this product into the fridge. But in case the patients won't come and we have the product ready, we can put it into the fridge and keep it up to even 30 days or more, because it's very stable even after dilution. Another question: is there a risk of sepsis forming after treating the buttocks area? Oh my God, another hard question. Yes, of course, in case you are doing this procedure in septic conditions. You should do it in aseptic conditions to avoid sepsis. Yes. So, okay.
Dr. Bart, apologies. I need to say my goodbyes now. I need to leave. I just want to say a big thank you to my esteemed panel of speakers. Thank you very much for your information and your knowledge and sharing your concept, skills, and experience. And I look forward to seeing you all soon. And thank you to the audience that have stayed with us and anticipate to see this lovely webinar. Thank you.
Thank you again. Massive thank you.
Thank you very much. Bye-bye.
Bye-bye.
Another question. Any effect on active acne? The biochemical mechanisms action of PDLA should help in theory. As far as I know, yes. If you use Juvelook, we can improve the treatment of acne. Dr. Sell?
Acne.
Yeah.
Acne is a real direct action. We can expect direct action, but this I usually treat many acne depression scar treatment with this material, but with the accumulation of this drug, many patients will slowly reduce the number of lesions. But this I expect no direct treatment for real X-ray treatment. And can I mention previous question? And the second and third generation perfectly different. The second generation have a more solid, so it's immune cell response more response more strongly. So M2 M1 switching is difficult to solid material, and releasing of acid is different. So I already showed the histology finding, so it's different. And another place, sepsis. Many worry about sepsis. I never experienced any infection at almost 3,000 vial in my clinic. I never experienced, because the lactic acid has aseptic antibacterial effect. Basically, have an antibacterial effect. It's different from HA filler. It don't make biofilm. So infection chance is very, very low. I never experienced that infection. Sepsis.
Yeah, thank you, Dr. Seo. Another point that there is M2 differentiation, more immunosuppressant macrophages comparing to other products. Yes, more M2 macrophages comparing to other injections. So it's more immunosuppressant after the injection. So it's very difficult to observe septic complications after PDLA. Another question, is there any suggestion for complication management? Yes, of course, we have standard protocols. They are available in our sales representatives. So yes, there are standard procedures for most of the typical complications. But remember that they are really very rare. When using meso technique, what risk comes with it, and is it painful? Are the nodules risk less? Well, when you do topical cream anesthesia and do mechanical injection with injector, I think it's one of the most comfortable ways to inject Juvelook intradermally. You can combine it, of course, with local anesthetic. So the more you inject, the more the skin is numb. So the more comfortable, the more you do the procedure. How long do the results of Juvelook last? At least 1 year. At least 1 year. But if we observe the collagen production, it will be observed up to many years after the procedure, especially in acne scar or treatment or other types of scar. Does thermal energy due to energy devices decrease the efficacy of Juvelook Lenisna? Do you tend to avoid laser treatment for a while after Juvelook? If you use radio frequency, it actually increases the efficacy of Juvelook and Lenisna. So we can combine it even in one session, as we mentioned before. You can use RF combojector from Beauty Europe UK to inject Juvelook and to do simultaneously radio frequency injection into the skin. I mean the radio frequency current, a high frequency current. Do you tend to avoid laser treatment for a while after Juvelook treatment? Well, I usually do 1 month interval between Juvelook and laser treatments. In case of radio frequency, I combine it in one session.
Yep. So it's energy combining of energy-based devices. Meaning is not melting away. It's already particle is soft, and glass transition temperature is below almost 41 Celsius degree. That meaning is softening, not melting away. So yeah. If we added an energy-based device, heating can make a nanoparticle. Nanoparticle can work well to make M2 polarization. So don't worry about disappearing. I always combine energy-based device before or after treatment. So you can detect the immediate result with the energy-based device. So I always recommend to combining artificial wound, some artificial wound can stimulate the stem cell.
Thank you, Dr. Sell.
Yeah.
Okay. I presume the question about sepsis death regarding buttock treatment are caused by people thinking it is a similar procedure to putting a large amount of dermal filler into the buttocks. This treatment caused a lot of issue and it's dangerous, and it has been recently banned in Glasgow. Yes, of course, AJ filler is generally one of the most dangerous substances in aesthetic medicine due to all the vascular complications. In case of Lenisna, remember we are injecting quite watery substance, and it's also very safe in case of vascular occlusion. So we are not afraid of sepsis and sudden death after the injection of Lenisna and Juvelook. You can do it safely.
Yeah, antiseptic material and the antibacterial material, lactic acid release. Acid is sterilized condition, can make a storage condition.
Yes. Any recommendations where I can purchase the multi-needle injectors and the Vortex machine? Of course, beautyeurope.uk, you can buy both. I mean, the injector and the Vortex. As far as I can remember, if you buy some vials, you will get Vortex free, I think. Do you do radio frequency first and Juvelook? Start with Juvelook and do the radio frequency. I mean, you can combine it simultaneously. Even with the injector, you do both injection and radio frequency after every needle insertion into the skin. So yeah, you can combine it in one session. Do you all want to go to bed now?
Yes.
Yes.
It's morning time.
Yes.
What time is it in Korea?
It's 7 a.m.
Oh,
Good morning.
Time to go to work.
I learned all day. I'm so tired.
Yes. Yeah. Is it
It's
effective?
in the wonderful meeting and interesting. Okay, good.
Thank you so much.
Thank you. Thank you very much. Massive thank you to all of you. It was a wonderful meeting, wonderful event. Thank you very much. And thank you for all attendees to stay with us up to the end. Thank you very much.
thank you.
Thank you.